My name is Bernadette Massay, and I am from Barbados. I was actually given the name of Dr. Badia by a colleague of my husband's, and then subsequently some other friends of mine recommended him highly to me. I had pain in my right shoulder, and after an MRI confirmed that it was I had rotator cuff problems. Well, actually, when I got Dr. Badia's name, I Googled it and saw all about the Hand to Shoulder Center, and I actually sent an email to Dr. Badia himself, and he responded in less than 24 hours, giving me the name of the international coordinator as the person that I needed to contact, and from there on it was very easy.
Mrs. Massay is a nice young lady from Barbados whose husband is a cardiologist and had been suffering with shoulder pain for about 6 months. Many times this deep, unremitting pain is due to deep pathology, oftentimes a rotator cuff, and in fact an MRI did reveal that there was a rotator cuff tear. Now she saw an excellent orthopedist in Barbados, but she really wanted this done in a minimally invasive manner, and the surgeon referred her to me because I do the repairs of the rotator cuff all arthroscopically. What that means is much faster recovery, minimal post-op pain, and we're able to do the repair all through 2 or 3 little holes that allow us to identify the tear, clean up the edges, and then reattach it with a bone anchor, which is a bioabsorbable mini screw basically that goes into the bone and is attached to the suture, and that brings the tendon back to its location.
My surgery was actually done on the 19th of January, and I started rehab here at the Hand to Shoulder Center. I think I did probably three sessions, and then I went back to Barbados and continued my rehab.
Those patients, if they have a good, strong repair, we can start early therapy, and then at about 3 to 4 weeks we begin gentle strengthening. I saw Ms. Massay today from Barbados and found that the excellent therapy she was having done in her home country has progressed her to the point where she has almost full motion already. And she's here really so I can do a check and also have our therapist do a few sessions to compare notes with the therapists back in Barbados. It's really critical that the providers here, the surgeons, our therapists, have good communication with the healthcare providers in Barbados to be able to provide these patients with the optimal care, even though they don't live here in Miami.
I would definitely recommend this type of surgery as compared to the open surgery, because the downtime is shorter, and for somebody like me who is an integral part of my husband's practice, doing medical reports, accounting, everything, I needed to get back to work quickly. I was able, between the 19th of January when I had my surgery and when I left Barbados on the 12th, I had done several medical reports and so on during that time, which in the given time period as this with an open surgery, I would not have able to do. Actually, several weeks after, probably about 3 to 4 weeks after I'd had surgery, I still had my sling, and I was in a supermarket in Barbados. I saw a friend of mine, and she asked me about my shoulder, and I said, you just had surgery at the Hand to Shoulder Center with done by Dr. Badia, and she then went to say, oh, she had a problem with her shoulder, and I immediately suggested that she needed to contact him. I recommend them firsthand.